Everyone, my name is Evelyne Bischof. I'm internal medicine doctor and oncologist, and I'm also medical director at Shiba Longevity Center and an oncologist still at the Renji Hospital in Shanghai. And I would like to talk today a little bit about the education. For those who know me, and I know that there are many people here that I would like to strongly acknowledge today, I'm very passionate about educating interns, students, doctors, residents, everybody who is in the healthcare system. So that includes, of course, therapists and nurses and admins and technicians and everybody who is helping us in running a department. And that includes probably also really everybody who is responsible for the department's safety and technique and cleaning. And I would like to present a few slides on education as we do it in the public setting in the department, but also a little bit more at large and globally. So as we are talking about healthy longevity medicine becoming a discipline, besides of guidelines, recommendations, protocols, hopefully that will happen one time with medical councils where we will have longevity medicine at least as a sub-discipline, everything starts with education. And I believe what we are doing right now is partially a sort of re-education, because we have to, on top of everything that we know and have to keep up with medicine, also educate ourselves on machine learning, AI, all the neuroscientific innovations that are coming out, the science. But at the same time, we are trying also to move the needle through also shifting education towards the really young generation, those who are coming out of the medical schools. And again, Longevity Education Hub, created in 2019 as free course for physicians, was a little bit of a tapping into this direction. And it was found in the COVID time, so of course online and of course for free, and it was started with introduction course, then grew into the long advanced course in longevity medicine. The first platform that picked it up, which I think not everybody knows, was NHS. So UK NHS doctors through the HDR UK platform. They have like a centralized educational platform. NHS was the first healthcare system that applied this course into their educational platform. And then we were working very, very intensively with MST, with the Medical Council, the American Medical Association for Education, to get ourselves accredited with CME points for doctors. And then all this grew. It's all a voluntary effort, so 100%, just like ARDD, nobody is paid. We do it because we are passionate. And the students' amount grew. We have now over 7,000, okay, 9,000. The numbers are being updated every single week. We have a weekly call still. So, okay, over 9,000 learners, great database, and great people who are taking the course all over the world. And through this, we had also inquiries from volunteers all over the world. So at this point, it's really a moment where I would like to acknowledge, thank, and bow down to all our volunteers who have been with us for all those years and also recently, those who have established the national chapter. So all those courses are available in their native languages. In Indonesia, our Dr. Birau Vilaksono is one of the leaders, and I will talk about him a little bit later, but he has initiated this course in Indonesian language. We have Dr. Yoko. Maybe you can stand up. Dr. Yoko Maceda, she has made the Japanese national chapter of the course. In Spain, we have Dr. Carolina Hernandez. She has even implemented this course into a master program in her university in Barcelona. I don't know if we have Christine Huang here, but she will be with us for sure later on. She has done this in China. And I will talk about the very special other chapter just in a moment. The hub would not be existing without all the other volunteers, which are listed here from all over the world, and our coordinators, Phoebe Zhang, who is with us online for sure, because she's also my assistant, and she's been doing the protocols for the past few years, and Dalila, our medical student, who has been our coordinator, and of course Dominika, which most of you now know since yesterday. She's been with us as well for a long time. I will separately introduce another very important coordinator, Andrea Olsen, a little bit later. But now I'd like to also move to a very, very important part. As I have mentioned on Monday, as of now, as of exactly beginning of this week, longevity medicine curriculum has been implemented in the obligatory medical curriculum in the university, the first university in the world, Makassar, in Indonesia. Indonesia is an important strategic country, very, very large population, very high level of doctors. So we will see first students finishing 7 years of their education at the university. Every single year, they have longevity medicine implemented in their core obligatory curriculum. We've been working on this for a long time, and finally it happened. An effort of many people and many brains, and of course it takes a wonderful rector and wonderful dean of a university to be open-minded enough to understand this important innovation, the core and crucial importance of longevity medicine for the students, to educate and not re-educate. Another interesting part is that the medical curriculum for residents is being implemented in Lithuanian University of Health and Science in Vilna and Kaunas. This is something that we did also with collaboration. And I would like to very, very deeply bow down to our Thai colleagues. So in Thailand, the national chapter is also being established as we speak. Thailand is a very, very core and crucial hub for Asia Pacific. We are also almost finalizing, if not finalized, so we are almost done for the next semester to implement the medical curriculum in the Thai university, which I will not pronounce correctly, so I will give the word later to Fa. And it's pretty amazing what's going on there, because also the students will be rotating at the hospital to also learn longevity medicine. Dr. Fa, can you please come here, because I really want to also thank them. The First Lady of Thailand has been here, who is one of the leading physicians in the country. It's wonderful to have a leadership in the university, in the politics, in the governments, and also great colleagues. So maybe you can have a few words about this program in the university.
Thank you so much. I think have to thank you, Eva, and also Andrea, who inspired us all for the education part. So this is happened because Eva spent your time at Bamrungrad Hospital, so we can introduce all of the head of the deans from the other university. And the dean of the university, KMITL, really impressed by Eva's presentation, so he's open-minded, and that's why we can implement into the fourth year medical students for the longevity medicine as a part of the block of the neuroscience. So I think it's very important to build the fundamental or foundation for the future doctors in the faculty, and also the Thai Association of the Preventive Medicine also start to open mind. So they allow me to give like a lecture for one subject about introduction to longevity for all of the doctors who want to get a board or certification for the lifestyle medicine in Thailand also. So we're going to see the future of longevity and lifestyle medicine blooming much more in Thailand, and hopefully to work and coordinate, collaborate with all of you to make it happen. Thank you.
Thank you so much. Thank you, Ka. Thank you so much. And also to acknowledge one of our volunteers, Dr. Amit Goldman, who has been leading the efforts in Lithuania. Great. So moving on, in Shiba Medical Center, we are also, of course, educating physicians. Being immersed in the public setting of the hospital, the largest hospital in the country, is helping us a lot to also move the needle. And what we've learned so far is that you really have to educate differently: the interns, the residents, the junior doctors, the senior doctors, the team of everybody. And we've been doing that now for a while. I think one of the most important things that we are really proud of is that resident physicians who are training in internal medicine and endocrinology can have a rotation in our longevity medical department as a part of their education, of their specialty training. We are very, very happy that we have interns who are rotating, so people who are at the last year of their medical study or the year after they finished the theoretical medical education, they are also rotating with us. And we have doctors all over the world actually asking us if they can come over and also train and rotate, do a sort of a fellowship training. So this is something that we are extremely happy about. We have journal clubs, we have CME courses that we do with external partners. We have grant rounds, we have POL, so problem-oriented discussions. And I think what's important is, you know, in this department, no, you don't know, Tsipi didn't mention, I will mention, we have specialties working with us, right? So we have the head of gynecology working with us. We have endocrinologists. We have people from bone density specialists. We have the head of psychiatry working with us because mental health is a part of the brain health department, and many others. So we are sitting every month together with all of the specialist experts, but also with our nutritionists, with our physiotherapists, with our research head, with everybody who is there. We also have PhD students who are working on the research, and I believe that's also very important. So we kind of also had to learn that after recruitment of the people working with us, we have to create some sort of educational training for them. And we've been doing this, I believe, almost 1 year before the center even opened, because it was so important for us to really immerse everybody into the mindset of longevity medicine. So we've done that, and we are continuously also trying to educate our young doctors in longevity, applied longevity, also together with our partners from the industry. So we are working with different companies, those who are making biomarkers of aging, those who are leading the lab efforts, and also some of the technologies like Quantalux, for example, based on an EEG kind of a method. We are measuring the predictive biomarkers of early dementia, but also early mental health disorders, ASAP, biological age measurement based on echocardiography of the heart, so our resident can actually perform the echo right there on every single patient, not only perform an echocardiography, which catches the actually sicker problems, but also to measure the biological age of the heart. Effectivate, which is a brain health, kind of a brain HQ type of an application for training of cognitive function, memory, and so on. And of course, we are also working in terms of translational science. As Tipi mentioned, we have clinical trials going on, together also with our partners from the Weizmann Institute, from the Reichmann Institute, and university, and others. So all the other studies that also were mentioned before are listed here. I think what's the most important is we are really making the change by letting our colleagues from other disciplines, from cardiology, internal medicine, everybody who is there in the same, not building, because it's a whole city of health, but in all the buildings in the campus, to work with us. And I think this is most important. So we are not only us as longevity separate from others. No, the whole point is to be a part of the system. And we'll be talking about that a little bit more tomorrow. What is important for me in education is that we have action and empowerment. So I don't think even this year I should be standing here. I think next year I will probably not even be standing here. I want to give voice to our young doctors, to our students, to those who are really behind all the work that we are presenting here. And this is why I would like to introduce Andrea Olsen, one of my students. She's right now in Caltech in California, unfortunately very far away. But she's been doing a great review, and she's been doing a lot of great study on biological aging clocks, and she will present briefly her work on biological aging clocks, methylation clocks, and epigenetic clocks.